This study was conducted 1 year back, and this was conducted in three hospitals simultaneously, in a private hospital and in Mr. Medical University ICU, in Medicare Hospital, the biggest hospital in Multan, their ICU, and in cardiac ICU there. So this is mainly related with the sepsis. As I was introduced by this drug, the main thing which was in my mind, I discussed with my colleagues, discussed with my people who are working in medical ICUs, with the pulmonologist, with the gastroenterologist. So the most of the studies results are very good in acute pancreatitis. In his role is in pancreatitis. But when I went through the other studies, most of the studies are from China and Japan. So they are preferred this drug in sepsis. But the thing is, what I was gained and concluded rather than the study published is that its role is in the initial stages of the sepsis. If you cover the SARS or infection, it's good. If the patients you are getting in multiple organ failure stage, it is very difficult to deal with the patient and to become reversible the disease by this study alone. But if we have given these this Ulinastatin in the initial stages, when their mediators are not yet released in the blood, it is a very good option. Once released, it will never go back. It will prevent the other cells not to release more. So, more experiences with my colleague, we will explain you because the number of cases are more. I have only deal with the 40 patients with the combination because already we are using dexamethasone in my cases. And in this study, I combined it with Ulinastatin and dexamethasone. The results are obvious, the results are good with a low dose. But in the next study, which I am planning with some of the ICU people here in Lahore, the combined study, we want to expand the number because we are not getting too much septic cases in our ICU setup. We need multi-center studies. So in this morning, I requested Professor Joseph and Professor Naila, just welcome Dr. Naila, to just cooperate with us to have a study in the cases of septic shock, or the cases of where the organs are involved and we can increase the dose of Ulinastatin, and we want to see the results as we are convinced by the study by Dr. Vishan and others in the China and Japan. In the China and in the Japan, this drug is very much popular. In Sindh, it is very much popular and is getting popularity day by day. In Punjab, the company is launching this drug from today, and before that they have given trial basis to many of the heads of the ICUs, and they did this trial, but nobody has, I think, did the study on it. Data registry is poor, and we did this study on the 40 cases and compared with the other 40 cases. Just I will go through fast. Already the time is short here. So sepsis, as you know, I don't want to go into the details of the literature, and I don't want to go into the details of the definitions because everybody knows. And in the beginning, Dr. Ahmed has told you about the mechanism of action of this drug and other things. So the thing is, we want to see the efficacy and application of with the dexamethasone in treating sepsis. So you know everybody that sepsis starts from the infection, then it goes to the SARS, then it goes to the septic, then multiple organ failure. So the best time of giving this drug is in the SARS. The best results you will get. But in the sepsis, you can get the results. The thing is only you have to increase the dose as they have suggested you. But by increasing the dose, you are increasing the amount of them because this drug is nowadays is very costly. And I think because when I discussed with the uh, suppliers, the vendors, with the doctors and everywhere, so they said that once it becomes commercialized, the price will come down. The other thing, I just asked them to bring the people because this drug is very much popular in China. I just requested them to bring the experts from there as well to have a meeting with us, have a joint ventures with us, and they can morely elaborate their experiences with us, and we can together we can have a more work on this drug because once we save a patient from sepsis, we save a one human being. The study conducted in July 22, it included 80 patients, 40 patients, 40 patients, two groups A and B. That's selection criteria sepsis included in the study. Subjects were excluded if they are minor or age above 50 years. I have seen, why I excluded the people above 50 because I have seen when I was not have included in the study, I used to give Ulinastatin to the people of old age in sepsis, but it's of no use in that. In age above 60 or 64 or 70, I have seen that the result is poor there if I using Ulinastatin there. So I have cut the age point here 50. Other colleagues who are using it, they can have a better opinion about this age. And one group, we have given 5 milligram of dexamethasone. Everybody knows that dexa is used in septicemias, and it also has a inhibitory role on the nitric oxide, which is vasodilator, and there's a big role in creating the septicemia, and also a big role in inhibiting the tumor markers and other interleukins and other things. In the second group, we have combined DEXA with the 50,000 units. 50,000 units mean half of the vial. So I just, why it comes to my mind to use 50,000? The dose is 1 lakh PD, or the dose is 1 lakh OD, or the dose is 1 lakh TDS or BD. I started 50,000 just to save the money and to add up dexamethasone with it to see the results. If the results are favorable, we can use this dose so that the burden should not be on the patient. Because everywhere the government is not in the public hospital, especially in Punjab, they are not affording to provide this drug on this such a huge amount is given to, because myself as running a hospital, I know how much funding I am getting. So I will be the last person to request to the government for this costly drug. So this is the fact. But if I use and save the life with the half of the dose, why not? Then I will, because people are they are using very costly antibiotics in the ICUs and the serious septic cases, and it costs about even 20,000 per ampule. So that is antibacterial. Why not we have to reduce the mediators first though, so that the antibiotic price can get low. So we can have a good balance by this. Next. Drugs were used for 6 days period. Both groups assessed and compared the general clinical efficacy. We have our results scoring with the SOFA scoring and the Apache scoring tool, which are the two scoring systems we are using in our ICU. And 5 milliliter fasting blood of the subject before and after therapy was taken to quantify the concentration of the mediators. These are all mediators we did through ELISA test. Next. Treatment efficacy in both groups was compared. Effective treatment was defined as Apache 2 score of less than 20. Major improvement in the clinical condition as well. So we compared not only the score, we are also looking after the improvement in the condition of the patient. And ineffective treatment where the Apache scoring is greater than 20 and there is not much improvement and there is deterioration in the patient condition. Next. So the other benefit which we received in these cases in the combination of DEXA and as all know now it is text version, that dexamethasone is also prevented this post-operative nausea, vomiting, and it is a good role in as an antiemetic as well, and other because it is a cell membrane stabilizing agent. So mixing with ulinastatin, which has also the major role in all these complications, you can see the reduction in all these muscle weakness. You can see the group A, 3, and we get 1 here. Nausea and diarrhea, 0, 0. Convulsions, 3, 1. Abdominal discomfort, 2, 1. So we can reduce these other complications of the sepsis by combining this drug with dexa. Next. So efficacies in group A is 27, group B is 35. Ineffective 13 and group B is 5. So it is obvious p value is 0.010. So its efficacy is significant. Next. These are the just comparing the heart rate, Apache scores, diastolic, systolic blood pressure with the creatinine levels. So you can see the obvious results that by combining the therapy, these all scoring are less comparing with the treatment before the treatment. So after treatment, you have a better result. Next. This is the overall result. That comparison combined adverse effects between the groups. In the group A, it's 32%, and in group B, in combination, so it is with this ulinastatin, it is 10% only. Next. A combination of ulinastatin and dexa is more effective in treating sepsis than dexamethasone alone. So, in my study, which I have seen in my 2 groups of 40 and 40, is not a big number of the cases. It's up to you, the persons who are dealing with the intensive care and critical care. They can have a better choice in future. They can increase the dose in the serious cases, and they can see, obviously they will see the good results. But I prefer to use one dose in 2 times, and I have seen the results are good. Thank you.